the sleeping that I meant to do, but yeah.
I saw the jets yesterday, the friends were in regard.
Oh.
It's a meeting to email. I emailed her.
I'm like, I should find this one thing and I can't find it. Can you tell me? And she's like, yes. Yeah.
Hi, everyone. I think we'll get started because we're a couple of minutes past 8:30. My name is Jeremy Kolitz. I'm a researcher at the Institute for Sustainable Futures at the University of Technology, Sydney in Australia. Yeah. And I'm joined today by Jamie Myers of the Sanitation Learning Hub at the Institute of Development Studies, and Avni Kumar, who's also from the University of Technology, Sydney. And we're happy to run this side event today on exploring climate impacts on rural sanitation and hygiene practices. So in a way of an agenda for today, we're going to start with some presentations from 3 different country contexts in which rural and sanitation programs looked at climate risks. So we have a presentation around a UNICEF intervention in Burkina Faso, a water aid intervention in Bangladesh, and an SNV intervention in Laos PDR. And in each one of those integrated climate risk into sort of a rural sanitation and hygiene programs in different ways. So following those presentations, we'll have a sort of an interactive activity from your chairs. We'll have you use your device to identify what you see as sort of key challenges to overcome in the rural sanitation sector regarding climate change. And then after that, we're going to have some group work activities, small groups to discuss strategies for overcoming the top issues that you guys will identify. And then we'll wrap up with just a bit of discussions around evidence and knowledge that we think are needed going forward. So just to kick us off before the presentations, I want to talk about why focus on climate change in a rural kind of sanitation and hygiene context. There's lots of more focus on climate change in the water sector right now, but I would say considerably less in rural sanitation. There's quite a bit in the water sector, and even urban sanitation is paying attention to it more, but rural sanitation, I see lots less attention. And I think there's sort of a question is, why should we be considering climate change in a context where many people are still practicing open defecation? We've been trying to eliminate open defecation for a long while now, and a lot of the people that are still remaining are kind of the hardest people to reach, the most marginalized, the most vulnerable people. When we're talking about these population groups that are marginalized, vulnerable, hard to reach, is climate change really what they should be worried about right now? And I think we want to say yes, because of a few reasons. One is that there's plenty of evidence that show that incidences of diarrhea increase with rates of precipitation and temperature. So in contexts where there's high rates of diarrhea because of open defecation, we can expect that to get worse with climate effects. I think a lot of you know that an ongoing challenge with eliminating open defecation and approaches like CLTS is that people build sort of suboptimal latrines that don't really contain waste that well. So if we're talking about more extreme weather events, there continues to be high risks of waste getting spread into people's living environments. I'm aware of a couple studies, one in Mozambique and one in Ethiopia, where they looked at communities that built latrines after being triggered by CLTS, and then flooding events came, and something like 45% of people didn't reconstruct their latrine after it was damaged by a flood. A lot of them just went back to open defecation. So in a context where we're having many more extreme precipitation events, more surface runoff flooding, that raises a high risk of people reverting back to open defecation. Same with droughts. Some of our own research that we did in Indonesia, in Asia Pacific countries where people strongly prefer flush toilets. If there's insufficient water, they can't operate the toilet, and a lot of those people just go back to open defecation. Finally, climate change affects people's lives in other ways. In rural areas, people are often dependent on natural resources for their livelihoods, for their income. Many of them are farmers, fishers, and those farms, fisheries, those are affected by climate change as well. So with fish stocks dropping because of sea temperatures rising and ocean acidity, agriculture sector is struggling with food security issues. People aren't going to want to prioritize sanitation if their food sources are being affected and if their income sources are being affected. So that's probably something we'll need to increasingly grapple with going forward as well. You might have seen this morning, the United Nations released a report saying that only about 26 countries in the world are on track to follow through with their Paris Agreement commitments. And we're on track to go to about 2.1 or 2.9 degrees warming this century, which is far beyond the sort of goal of limiting things to 1.5 degrees. So we can expect for the foreseeable future to see really severe climate impacts, kind of culminating in catastrophic environmental impacts that we have no choice but to work within. So with that somber note, we're going to go into some more positive thinking about what can we do to work amongst all of this. So I'm going to hand to Jamie Myers first, who's going to present the Burkina Faso case study. Jamie.
Thank you, Jeremy, for sucking the energy. No, I'm joking. So my name is Jamie Myers, and I work at the Sanitation Learning Hub at the Institute of Development Studies. And I'm presenting on behalf of my colleague, Ruhil Aya, who's also based at the Sanitation Learning Hub, and Dr. Leah Pua, who works at IRSS, which is a research institute in Burkina Faso. So just a bit of background to the three case studies is that the research team at ISF and IDS reached out to different organizations to see what type of research they wanted to undertake related to climate change. And in Laos and Bangladesh, they were a bit more further ahead with their thinking regarding to climate change and their WASH programs. But in Burkina Faso, it's a bit behind. So they were quite keen to look at what the climate impacts are on sanitation and hygiene in rural Burkina Faso, and then consider those impacts through some workshops. So the case studies in Laos and Bangladesh are a bit more further ahead and a bit more action orientated, while this was very much, they wanted to strengthen the evidence base. So just to set the scene for those of you who might not be familiar with Burkina Faso, it's a landlocked country in West Africa. It has a population of 18 million people and 70% live in rural areas. Temperatures are predicted to increase by 3 to 4% by 2080 to 2090, which is much higher than the global average of 1.7%. The eastern region, which is the red, where the research took place, is already experiencing a combination of both high temperatures, heavy rains, pockets of drought, and water scarcity. And just back to the WASH context, in rural areas, open defecation is still practiced by over 54% of the population, and only 13.46% have access to a basic facility. And the main program modality in the eastern region is CRTS, which will be important later. So regarding what we were looking to find out, firstly, is how the climate hazards directly and indirectly impacting sanitation and hygiene practices within communities, how these impacts are experienced across different people within communities, and how are people coping with these impacts, and are there any local responses we could capture? We also wanted to find out is how climate hazards were already affecting the sanitation program, and how could the program be strengthened to better support rural sanitation services and community resilience. So regarding the scope, the study took place in 4 villages. 22 participatory focus group discussions were held and 35 key informant interviews. And so a total number of 208 research participants engaged in the process. Regarding methods, during participatory group discussions, impact diagrams we used to explore the direct and indirect impacts, while hazard mapping was also used and involved the mapping of communities and then identifying where in those communities hazards occurred and how it affected different households and sanitation and hygiene practices. This was also included in research for key informant interviews with semi-structured interviews with local officials, community leaders and NGO staff, and 2 workshops with UNICEF staff to think through the findings and develop some recommendations of ways that programs could be strengthened. So communities in the eastern region were experiencing 2 major hazards. The first being heavy rain and irregular rainfall, and the second being dry spells, droughts and desertification, which had both direct and indirect impacts on sanitation and hygiene practices. So we'll go through irregular and heavy rainfalls first. So the direct impacts were significant damage to infrastructure, as most of the trees were made of wood, earth and straw, which were unable to withstand heavy rains and faced rot and termite damage. Contaminated pits, even when covered, was sometimes overflowing and collapsed with excessive rain. People then becoming fatigued, having to repair facilities frequently, and partial damage causing people to stop using the latrines for fear of more damage. And regarding indirect impacts, these events also lead to the loss of livelihoods through crop damage and failure, as well as illness and death of cattle, which caused the deprioritization of sanitation over other investments. Regarding dry spells, droughts and desertification, a lack of water made it challenging to clean and maintain latrines and maintain hand washing and menstrual hygiene practices. However, a decreased bush cover had perversely led to reduced space for open defecation and increased demand for latrines within some of these communities. And indirectly, women faced an increased burden to manage domestic work like cooking, cleaning, and laundry with reduced availability, and similar to irregular and heavy rainfall, with loss of livelihoods and crop damage and death of cattle. This led to a deprioritization of sanitation and water also being prioritized for other things in times of scarcity. Okay, so regarding impacts and programs, with reduced water availability during dry conditions, it made it difficult for practitioners to encourage communities to build latrines, especially in households with no bore wells. Very expensive emptying services meant that households resorted to digging another pit when the first pit filled up. So they dig another pit, cover it, which could be classed as a safely managed system. However, 4 pits were collapsing with inundated water during periods of flooding, making it an unsafe sanitation facility. And then rains and floods that were leading to frequent breakdown of infrastructure, increased fatigue and difficult with behavior change programming. So some of the local coping mechanisms were rebuilding latrines with available material after each rainy season, relocating the facilities to different parts of the village, which was less impacted by flooding to better protect them. Rallying around as a community to help households with toilets, which were affected, to help rebuild after the rain. Barricading yards to reduce stormwater inundation. Investing small pots of money during the dry season to make toilets invest in toilets before the rainy season began and making them more resilient, and using toilets in the dry season, using toilets as washing spaces in the dry season to save water. So some ideas for responses to programming, which were developed through the workshops, Firstly, we have integrate climate risk factors into ongoing sanitation interventions, for example, through triggering and follow-up, providing advice on things like materials which are more robust and site selection for toilets. Building local capacities, so training households and local masons who are based within these communities to reinforce substructures and superstructures and support operation and maintenance. Thirdly, to conduct drainage systems and latrines to help prevent the collapsing of pits. Expand behavior change programming to build the habit of prioritizing latrine inspections before the rainy season begins. Then drawing on existing community support funding mechanisms and networks to increase the durability of latrines. And finally, building on the strengths of CLTS, so increasing people's understanding of the importance of sanitation, while at the same time considering what alternative programmatic modalities might be needed in areas where or in areas where particularly low, not robust latrines have been built. So just some conclusions. Damage to household infrastructure and latrines and the loss of livelihood options magnify vulnerabilities and household stress. Competing needs with financial resources are means that they're less likely to be used to rebuilding latrines, and continued use of latrines. Consistent climate hazards are increasing fatigue and reducing motivation to maintain safely managed sanitation. There's a need to think about both safe managed robust technologies and ensuring prioritization of maintaining those technologies after a climate shock. There may be a combination of responses that can complement and build on existing sanitation approaches. And finally, climate impacts challenge sustained sanitation outcomes. So recommendations currently emerging from sustainability related research will remain more pertinent as we see increases in climate hazards. And that's it from Burkina Faso. Thank you. So I just press play.
Oh, yeah. Thanks for Jamie. We'll have a bit of Q&A after the end. We'll do all three presentations first. So if you have questions for Jamie, hold on to them now. We have a pre-recorded presentation from WaterAid. We're going to present on their participatory ward vulnerability assessment. So I think this should play.
Hello, this is Samiha from WaterAid. Today I'll be presenting the case study from Bangladesh, where we assessed communities' worst vulnerability in climate change context. The method we followed is known as participatory ward vulnerability assessment, which was first introduced by WaterAid Bangladesh in 2013. This is a mixed method process which has both quantitative and qualitative data collection tools. The qualitative data collection tool can be segregated under 10 major steps. Also, the process is implemented in the lowest tier of administrative region in Bangladesh, which is known as ward and often has 500 to 1100 households. And for this case study, we are conducting PWVS in 9 different wards. The final findings of the process is usually used by local government authorities as well as non-government agencies who are working on wash and climate change adaptations. We have also seen other development practitioners often using the findings from PWVS. So in this map, you can see the area where we are conducting the study. This is situated in the southwest coast of the country. And the area is heavily affected by different climate change-borne hazards, including salinity, cyclone, flash flood, waterlogging, and heavy rainfall. It also has different ethnic minority communities and people from diverse religions who are involved in fishing and farming as occupations. The PWVA process is being implemented in the field by Rupantor, which is a local NGO working in Bangladesh, and they are working in partnership with WaterAid Bangladesh. Through this case study, we are trying to answer these 3 major research questions. Firstly, we want to see the co-current status of wash facilities in the climate vulnerable area. that we already choose. Secondly, we want to understand how climate hazards are impacting water sanitation and hygiene practices in rural Bangladesh. Lastly, we want to identify different course of actions that can be undertaken by various stakeholders in order to address the ongoing wash issues. So for quantitative data collection, we are collecting data from each household, school, and healthcare facilities through our trained surveyors. In the right, you can see two pictures of our surveyor training, and the other picture is about data collection by one of our surveyors. For qualitative data collection, we are mostly focusing on the wash problems led by different climate change-borne hazards. And as a part of the process, we are producing a different type of documents, including social maps, seasonal calendar, and a comprehensive plan to address the identified issues. In the right, you can see two pictures from two of our PWVs conducted for this case study. In the figure B, you can see one comprehensive planning workshop held for one of our PWVs. And in figure C, we can see the illustration of problem priority analysis, which is another component of our qualitative data collection tools. In addition, we are also collecting data through FGDs only arranged for women, and the discussion on those FGDs are mainly focused on menstrual hygiene management. Aside from this, we are validating the collected data in 3 different administrative tiers, which ensures good quality of the collected data. So moving forward, since the data collection process for this case study is still ongoing, we have clustered the major findings from the field under these 3 major categories for this presentation. So regarding climate hazards, we found many of our participants saying the unique seasonal pattern of Bangladesh is currently changing, which is evident by the late arrival of monsoon and winter for the past few years. Also, the participants said that the frequency and intensity of cyclone and rainfall has increased drastically across the study area for the last few years. Regarding drinking water, we have found increasing trend of salinity across the area, which is drastically affecting the water quality, even in the freshwater ponds and also for underground water. In terms of sanitation, we have seen waterlogging and flash flood to often inundate the sanitation facilities of the study area. Also, the toilet pits are filling quite fast, especially during the monsoon period. In addition, since the water quality and the sanitation facilities are not in good status, we often see that the hygiene facilities and practices are quite poor as well. Especially women are suffering a lot to manage their menstrual cycle using saline water. So these are the different topics that can help to resolve the identified wash issues. Firstly, we can mention about locally led adaptation, which can be applied in the study area context in order to resolve the identified wash issues. And it has several principles which are very much connected with our identified wash-borne hazards. Aside from this, we should also ensure the prioritization of the identified wash issues in the local governance budget planning so that they themselves can take the lead to resolve those issues. In this regard, planning should be ensured at a ward level because the context of different wards varies a lot from each other. And here we often use the term one ward, one planning. The course of actions to resolve the identified wash issues should also include inclusive and equitable service assurance, climate resilient wash facilities, and sustainable coping mechanisms. That's all from my end. Thank you so much.
I'll just add to that presentation that WaterAid has had this PWVA process in Bangladesh for a while now in sanitation, learning hub, and UTS. We're supporting them to have a bit more increased focus on sanitation questions in their assessment processes. So I'd like to hand to Avni Kumar now, who is going to present on behalf of SNB Lao on their intervention.
Thanks, Jeremy. So yeah, I'll be presenting a case study from Laos, and just wanted to mention this work was done in collaboration with SNB, and I'm presenting on behalf of the entire team at SNB Laos. Moving on from Bangladesh to Laos, I'll be sharing lessons learned from integrating climate risk considerations into SNB Laos's rural sanitation programming. And this was particularly within their CLTS programming activities that they're carrying out in Laos. Shall I just do, I don't think. Sorry about that. So yes, prior to conducting, so we conducted 3 activities to integrate climate risk considerations in CLTS, community-led total sanitation programming. And prior to conducting these activities, we did a workshop with local government stakeholders in Laos. And this workshop was mainly to orient them about, the basics of climate change based on the context in Laos, and what are the different impacts that climate change has on rural sanitation, focusing as well on the particular impact on gender and other vulnerable and marginalized groups in communities. We also talked about responding to climate change impact, so what communities can do in small, low-cost ways to deal with climate change better. And also discussing on, how can communities be mobilized and build more resilience towards climate change. So the 3 activities were carried out in a province called Savannah Khet, which is in the southern part of the country, which you see on the slide there. And the communities in Savannah Khet province were chosen as pilot sites for these activities because in the past they had experience of flood hazards. So we decided in consultation with the SNB team to focus on flood hazards for these activities. And SNB had already been working on rural sanitation programming in this province. So they were familiar with the context as well as experiences of different climate hazards. And that's why we chose flood hazards to work with. These 3 activities were easy to implement at a low cost by community facilitators. And these are government staff at the local level who work with SNB field staff to facilitate these different CLTS activities. So SNB trained these community facilitators who eventually implemented the activities in the villages. The facilitators also had some previous experience of implementing CLTS programming, and therefore they were very enthusiastic for integrating flood risk hazards into CLTS programming. And most of them also had some understanding about climate change based on the workshop that we had conducted in the past. So the 3 activities that we conducted were climate sensitive community mapping, transit walk, which included flood risk hazards, as well as power walk. And I'll describe each of these in the following slides. So some of you may be familiar with the standard community mapping exercise, where community members work together to create a map of their neighborhood or village, and they mark important sanitation related infrastructure, open defecation sites, households, places of worship, etc. in the community. And this activity added a flood hazard to the standard community mapping exercise. And the objective of this was to prompt participants to identify the locations in their villages that are impacted by flood hazards and heavy rainfall as well. And it encourages them to proactively think about how these hazards influence sanitation and hygiene behaviors and worsen the impacts of, for example, open defecation. And the activity also prompted the community to think about the differentiated impacts on women, pregnant women, people with disabilities, other marginalized people in the community. So the second activity was a transit walk, which is a part of your usual CLTS triggering process. So standard version of the CLTS transit walk involves visiting sites of open defecation or poorly constructed toilets within the community and asking questions to consider the impact of feces in the environment. And this activity built on the transit walk by further prompting community members to consider interactions between flooding and poorly contained feces. So for example, this was done by visiting areas in the village that get flooded more easily and that get flooded first. So for example, lower lying areas in the villages would tend to get impacted by heavy rainfall. And we discussed with the communities how the impact of flood scenarios affects open defecation sites or shallow pits in the area. For example, visiting open defecation sites and discussing where the feces flows to when there's rainfall. Do the community members continue to use that open defecation site during heavy rainfall, or whether they defecate closer to homes? A transit walk can also include visiting a well-constructed toilet facility and talking about access and functionality of that toilet during heavy rainfall. So the third activity is called Power Walk, and this was a new activity that was added to the CLTS triggering process. And this activity aims to assess the social context with respect to flood impacts on sanitation and hygiene behaviors. And it can be a really powerful tool to demonstrate how community power structures and individual agency can shape response to climate change and, in this case, flood hazards. So the activity involves community members role-playing different characters in the community. So, for instance, the facilitator would ask people participating in the activity to imagine themselves as different members of a community. For instance, a person with disability, or a pregnant woman, or an influential leader in the community. And then the facilitator would narrate certain climate hazard scenarios and ask each person to take a step forward or backwards based on whether they are better off or worse off in that climate scenario. So, for instance, a scenario would be like flyers are handed out by an NGO on how to cope with flooding impacts on community sanitation. Can you read the flyer? So, for instance, a well-educated member of a community or an influential leader might step forward, while a participant who has a lower level of literacy or is visually impaired may step backwards. So this activity, the objective of this is to convey to the participants about the differentiated impacts of flood risks on the community and how different groups of people may benefit more or less from different interventions. And it highlights that in addition to the physical impacts of flood, the social dynamics in the community also plays a lot of impact in how people cope and respond to climate change. So just to wrap up, a few reflections from our experience. It's important to build on existing activities, and therefore we decided to work with the existing CLTS triggering approach that SNV was using, because we are conscious it's often very burdensome for community facilitators also to, implement a completely new activity. So the idea was to, have easy and low cost ways to do this into their existing rural sanitation programming. Another point to note is to keep in mind the local climate risk profile. And in our case, this was identified as flood hazard risks, and not talk about different climate hazards, which might tend to confuse or overwhelm the community members. Keeping things simple, checklists help. So we prepared like one-pager checklist for each of these 3 activities, which really help the facilitators to implement the activities and keep in mind the points regarding flood risk hazards and the questions that prompted discussions within the community members. And lastly, we held frequent debrief meetings with the community facilitators, and this helped to do any course correction during the pilot, change or tweak things based on their experiences, because since some of these activities were carried out for the first time. So that really helped in fine tuning the activities and, making them more effectively implemented. So yeah, lastly, I just wanted to mention that we really like from this case study, it was quite evident that, SNB Laos and the community members were really open to integrate climate risk considerations and considered it very important and useful to do so. And this need not be an overwhelming thing that, local NGOs could struggle with. There are small, low cost, easy to implement ways that you can build community resilience with. And that was what we were trying to convey with this case study. Thanks very much. And I would like to hand back to Jenny.
We'll take some questions now. We just have time for a few if you wanted to ask on any of the three presentations. Each of us sort of presented on behalf of another organization, so if you have really kind of specific technical questions, we'll do our best to respond. But yeah, just wanted to check, does anyone want to ask any questions about those three presentations? Yes, please.
I have a question for Jamie. So you talked about flooding hazards and also drought hazards, and like the ability for the community to cope with both of them. I was wondering, like in the context that you studied, the flooding hazard might be more idiosyncratic, where some households are affected, some households aren't, based on like where they live and the distribution of the flood. For drought, it might be more covariate, where everyone's affected by drought. Do you find that it was more difficult to like help each other when everyone's affected compared to a drought, compared to a flood?
I don't think it's a detail. But I can find out and follow up. I do know that some of the households had four wells to access to water. What other households didn't, so I don't know if that made a difference. But I will give me a card and I'll follow up.
Okay.
Any other questions?
I have a question for Anthony. For the Lao context, I mean, I don't know how far into the Lao process you are, but I found the case study really fascinating. I'm just curious to know what happens next, or how are the lessons and insights from those activities integrated, or how do you carry that forward, or what's the plan for that?
So great question. Thanks, Stand-up. So we had some conversations with SND Lao on, where to next, and they were like, so these were piloted in a few districts, and they were keen to, do these in other districts as well, because they found it really useful considering the context. So we're hoping that they will integrate these further within their programming and train their community facilitators in implementing these in other areas as well. Jeremy, would you like to add anything to that?
Yeah, as to say that this was, I guess, was a pilot, and approach needs a bit of refining. One of the challenges is that CLTS is already sort of a full day. The community facilitators have a lot to do. You're asking a lot of the community's time, and now you're asking them to overlay like more considerations, and that's quite a bit of a challenge. They were enthusiastic. We got good responses from the local government. Lao has national CLTS guidelines, and they were already pushing to say, let's revise the national CLTS guidelines to include climate resilience stuff. And I think we wanted to pump the brakes on that a little bit, because it was just a pilot. And before we want to tell everyone in the country to be doing this, we need to work on it a bit more and make sure it actually makes a difference. Even, we have to, I mean, ideally, the idea is that community members will they'll either trigger them to build more appropriate latrines that are more appropriate for flooding conditions, or that they'll expect that they'll need to rebuild every once in a while. But whether or not these things actually have that effect, we don't know yet. So I think there needs to be a bit more research on that.
Maybe just to add that all three case studies were designed in a way to have reflection workshops with the participating organizations as a way to improve their programs. So the idea was that the research was helping support an evolution of the programs, both for UNICEF, SNB, and WaterAid.
Any other questions? Otherwise, we'll go to the next activity. So the next activity, it's a sort of a Menti activity, which you can do from your chairs. So what we do is we have a question for you, and it's what is the biggest challenge that you see that we need to overcome in rural sanitation with regards to climate change? So the way it's going to work is there's this Menti code here. And when you go to menti.com and put the code in here, and when you log in, it's going to go to a Q&A slide, and it's going to ask, do you have any questions? So you're not asking a question, actually, you're answering this question. So put in your biggest challenge, and on your device, you should see what challenges other people are putting in. And you can give a little thumbs up, a like to other people's suggestions. So vote on other people's suggestions if you agree it's a major challenge, and we'll see what bubbles to the top. So take a minute, you can put in as many suggestions as you want, and you should be able to sort of scroll through on your device and see other people's suggestions and hit a thumbs up if you agree with theirs. So please do continue to look, give the thumbs up to anyone else's. So far, we've got governance, behavior, mindset, rebuilding latrines, political awareness, local masons, and political will.
And there are a few.
So-
Yeah. How do you get it open to it? Then I do this one.
So far, household investment for resilient infrastructure is on top, 11 votes. Second place is governance. Third is tied for second, political will, behavior. Taking that one more minute. If you want to add some more, continue to vote. Okay, so we got 19 suggestions, 20. I can continue to add. I'll go through quickly just so you can all see. Actually, you should be able to see on your device as well. But as we said, household investment for resilient infrastructure is number one, political will, governance, behavior, mindset, competing life priorities, community buy-in, severe irregular climate hazards, local government awareness, coping capacity. Actually, there's quite a few in here. Maybe I won't go through all of them. I think you can see them on your device. So what we're going to do now is we're going to do a bit of small group work and talk about strategies for overcoming what we see as biggest barriers. So with this group, we will have 3 or 4, maybe 4 groups, and we'll look at the top 4 challenges that we voted on. So household investment, governance, political will. No, these are tied.
Does anyone want to do an additional vote?
Do I want to do a tiebreaker? Competing life priorities or behavior mindset? No, we'll figure out. Okay, behaviors. Okay, behaviors it is. So let's roughly break into maybe quadrants of the room. Maybe folks from from this row forward. Let's take that back. Yeah, everybody go to you guys forward. Yeah. That's true. I hate that. I really. It's not, we're very awkward. Stuff is rough.
Yeah, thank you. That's what I.
Should we let people choose which?
We could, yeah. She could understand. What was that?
Lawrence.
You were trying to use that, right?
And just adding there can. We talk to so many different people. We provided. It's great. And there's no reason on that. Without this, their life in those really one, like, I mean, it's not an existing one. They have enough of it. And so talking about the priorities to the just felt, so it could be more, they knew about important, but not. Yeah, literally. So the house.
Possible investment, I think it's okay. If you guys are keep the the other one I did is political will. Oh, it's.
Yeah, it should be this thing. I'm not sure. It's on. Oh, it's definitely not on. That's it. Wow, that is unfortunate.
All right.
Very small.
What is that, you know, and so we feel a lot of things. Amazing and like leadership and somebody that and changes at like a national level and very different.
But just not being under. I'm wondering whether or not it's like more.
Going forward, you feel that there's always that some good levels of leadership and water here, or there's gonna be no, that's not here. I think we could close this.
Yeah.
Well, that's it.
Water communities and brought by so many years, speaks with the community, we operate in the, you know. They're super small. On their beginning is association. They're not going to be board of adjustment. It's non-existent in the village of house together. I mean, they are never down. Again, for pulling money on this. If they was paying for testing or maybe you don't. Decentralized, where like nice people, they did like use or like over our. That helps. Sometimes people participate. But I don't know, so like, making associations, so that. Like, what are your audience that were.
Maybe your has water. Lines are like volunteers that just got through the back door, they have like water. But we help them understand it. Help them make it. We give them I never left them out of the air. Five more minutes. It's all there, 3 points that you want to report back to. The challenge of that is. Sanitation.
I don't think so, but.
English, yeah.
It's really I didn't make it on work. Influence, they're all the future like that. They're all funny.
We'll do 5 more minutes. Discussion. So then all the I didn't want to, to change their. This somebody that's accountable to the over. So one is about your community.
No, I was, I think you're about
So they're paying what you start. They're figure out per month. Let's solve 10 more than from us, very small. Manage that small fund to help
And
it.
maybe the third one. Pretty low.
It's still from the better best.
Internet.
Raise.
There would be some family that would not necessarily benefit, right?
It's the net between the whole. It's a published good.
Maybe I'm like, sort of like the SLA micro, where like. So what you said, no, but
What else? Could we have? I think
I mean, before we try to say someone else can pay for it, but it's what?
And that's not always easy.
Well, they're implementing policy.
Okay, folks, just wrap up your conversations. We're gonna start to come back together.
They're it takes a lot, but if they are getting policies in place, they're role in this.
I think everyone, we're going to have one of the groups, Dominic over here is going to present. I can to report back on the group. Yeah, you can come up to like please. Which group are you from, Dominic, or what was your
I think I'll focus on the computing interest at the household level. And we look at.
I think you might have some other lines. That might be offline. Yeah.
Yeah, so we looked at how at the household level, they will be able to mitigate the impact of climate on the sanitation products. And then we look at how they can build climate resilient facilities. And then the main breaking point that we came up with is that it should be a community-led. Trying to build a resilient facility should be a community-led. So the design and adaptation should come from both the household and then the community. And then the second point is that the government should come up with regulations to support climate resilient infrastructure by maybe giving tax incentives and also regulations. And then we know that in most of the areas that we work, the government, they don't have enough funds to maybe provide those subsidies. And that's where we are thinking that in that case, then they can go into the international market. We know of the climate funds or the climate financing, but what we are seeing is that most of the funds goes into the energy sector. So maybe it's about time to went in there to try and get more funds to support climate adaptation facilities. Thank you.
Thanks, Dominic. Does any other group want to volunteer to go next? Maybe over here.
I don't think it's working.
What was your group? So the investment one, yeah, the top one.
Oh, there we go. Household investment for resilient infrastructure. So we had a great discussion, our little group here. We talked a lot about looking and listening to what people currently like, whether it's about their current facilities or about their current practices. So understanding what they value and what they don't want to change in terms of their sanitation practice, and then figuring out how we can market towards those desires and create whether it's, you know, advertisements or whatever it is, market towards those, desires that people have, and then giving people contextualized choices. So obviously Bangladesh, the 3 choices that people might have in one community, very different from the 3 choices of technologies they have in Burkina Faso, but letting people have choice of what they can purchase. So we didn't, so obviously we talked a lot about willingness to pay for latrines now or earlier, and how like that wasn't always there, and so you add the climate resilience and what does that really mean? But obviously we don't have an answer to that. So.
Thanks for having.
Hi, good morning all. Our group talked about the political will aspect of the challenges related to this. And I think we shared a lot of similar points that you shared, but yeah, thinking about the challenges at both the national level and at the most local level. What was wonderful to see in the presentations this morning was just that effort to really empower the local leadership with the awareness of the issues and challenges, and come up with practical actions that could be somewhat simple to implement. But you have to create that value proposition somehow, and help national level government see the value proposition in strengthening systems that address public health issues. So what's the language that speaks to the political leaders of a country, so that they can see why it's important to create an enabling environment, create the necessary investment vehicles for communities to have access to resources they need to address this. I think one other point we just talked about was just linking not only sanitation but water in this is important. Both services are affected, and we discussed just helping communities think about this a little bit more holistically. Did I leave anything out? All right.
I'm sure my colleague did. So, well, we might have a 2-part presentation here. Well, we chose governance as the main topic for climate change and sanitation. And well, from the perspective of governance, we have the notion of creating a forum that includes public sector, so governments and municipalities, as well as civil society and community groups, and the private sector. And perhaps that kind of three sector constellation could lead to nice conversations and innovative products that could come out from the needs of all the 3. We also talked about having economic drivers, economic drivers as a motivator to get climate change on the agenda in different government groups, such as ministries of health, ministry of economy, and other ministries that do exist, and the notion of climate change for sanitation in the context of the economy, the economic side, the health side, agriculture side, could be a common thing that brings those government ministries together to improve governance. Anything else? Maybe I'll pass it over to
Thank you. Actually, my colleague explained everything. I just wanted to one example regarding this, or just briefly what's actually story in our country, Bangladesh. As you know, Bangladesh is situated in the coastal area, and especially the coastal areas of Bangladesh, there are lots of issues we have just you offered to these presentations. And one Dutch NGO, Dutch organization is working in Bangladesh, Next Foundation. Most of you know about them. So Next Foundation, what they do, they actually initially they start work with our central government, 2 ministries like Minister of Local Government and Minister of Health. And then these 2 ministries, they actually sensitize their territorial government, like the district, sub-district, and union level, their representatives. And Next Foundation also work with the local NGOs, like those who are working with the clean water, some are working with the sanitation, some are working with the menstrual hygiene management. So they just brought all of them in a single umbrella, and also they give education to the community members, local entrepreneurs. They also build a business model there. Like the local shopkeeper, they give sanitary products to the older women of the community, and the older women have good access to the adolescent women. So through this way, the adolescent women in a marginalized area, they doesn't have any knowledge. They don't have any knowledge about the menstruation things and menstruation products, but they are now well educated about these types of things, and they know how to manage this situation, how to discard these products. So they have very good idea, and which is very difficult to the other areas of Bangladesh where these activities were not done. So I think this is a very good success in our Bangladesh, and Next Foundation is very successful to sensitize our local governments and Ministry of Health in these areas. So I think these types of political will of governments would be helpful for other areas, and it could be like implemented other areas. And actually those villages are called a model village program. If you just start Next Foundation model village program in Bangladesh, you can see very good success stories regarding this. Thank you.
We had such a diverse group in different countries. And one of the things that came across was the transition of governments over 2 to 4 years makes it challenging to have a continuity in there. And how do you institutionalize in a way that when there's a shift, the political will does not take away from what has already been developed? And I don't have an answer for any of us. The guy that's mentioning that.
Great, thanks for that, everyone. It was really useful to hear. I should have mentioned, I believe Sanitation Learning Hub will publish a blog post based on some of the discussions here. Is that right, Jamie? I'm not putting you on the spot.
Oh, okay, yeah.
I think that was a real suggestion. I'm taking notes. Well, I think it's really worthwhile because, as I mentioned earlier, I personally observed a lot less activity and attention in the rural sanitation sector, the climate change and WASH, and there was a lot of really rich discussion now, and I guess it'd be a shame if it was just in this room. So if that sounds like a good idea to everyone, I think it is a good idea to document some of the thoughts that you shared and put them out there, and hopefully we continue to contribute to a conversation around the topic of climate change and rural sanitation. On that topic, we've got 13 minutes left, and we have another question for you. And again, this is a question for you guys: what evidence or knowledge do you think we need going forward in order to inform a lot of the strategies that you talked about? So evidence could be in a traditional research academic way, or it could be just in terms of documenting experiences, practical knowledge, tacit knowledge of people that work in this space. So does anyone have any thoughts or suggestions around evidence or knowledge that you think would be useful going forward? Yeah.
So also in our group conversation, we had the thought that the definition of climate resilience, what this means, is not so well defined and in a universal way across the various sectors that exist. National governments, the municipalities, they may have a different definition compared to private sector and communities on the ground. So perhaps sort of the universal definition of what climate resilience and climate adaptation means could be an area that more knowledge and evidence could be developed.
I think so. If I could react to that, there's like IPCC resilience adaptation definitions, but they're so high level, they're so abstract because they're meant to cover everything under the sun that they're not really operational. So I think what would be really good is what is resilient sanitation, or what does it look like for sanitation? What does it mean when we talk about resilience? What is and what isn't resilience? And then that gives sort of a common framework or something for us to look behind. Diana?
Yeah, I think building on those 2 points, I think, I don't know if it's evidence or knowledge specifically, but maybe tools or skills. Is communication, how do you communicate the same message to different audiences? Because I think that's what's really complicated about climate change, in the context of sanitation and any other aspect of WASH, is just how do you communicate really complex ideas, very forward-looking in some cases, to communities, but also to leaders and also to, you know, just different actors in the whole climate change network.
Yes, I'll hand it back. Yeah.
Yeah, it does. Just gonna hold it close.
This reflects my, oh yeah, it does. This reflects my ignorance of climate change data, but are there accepted resources we can go to predict what kinds of changes are coming that the countries generally are accepting?
Yeah, I can attempt to answer that one. There's plenty, basically, it's the higher the level the scale is, the better the projections or the more appropriate they are. So at the global scale, great, like IPCC collates those. Continental scale, good. Once you start to get down to national scale, the sort of accuracy, I guess you could say, of those projections starts to get limited. If you're going all the way down to a community level, then the projections are just there's severe limitations in that. I mean, there's certain things that we know for sure. We know it's going to get hotter. If you're in coastal regions, you know sea levels are rising, but precipitation is the big one. I think that we're often worried about in WASH. And precipitation is really hard to accurately predict. And then there's all sorts of other contextual factors. It's not just about precipitation, it's about water demand and land use activities and the types of aquifers and things like that. So the projections aren't going to save us. I mean, they're a useful tool, but if you're talking about like local level, like a CLTS program, I think they have limited utility. I think there's a comment over here.
Yeah, I think something that the three presentations earlier highlighted well is the importance of local context. We've learned from, I guess, historic international development that one size does not fit all, and I feel like you have to know what's going on in a community in order to figure out what does fit.
Thanks. On the back.
You know, at the planetary session, whatever, that main session, yesterday, that's what it was on capacity building, right? And in the very beginning, it was discussed how there's very little data on that ability to, and I'm an academic, been an academic all my life, but I go out into the field because I believe you need to go out and learn from that, learn from my colleagues out there. But one of the things that's bothering me a little bit as I matured is how we continue to reinvent the wheel of every generation in there. And my father was also an academic, and he accused me of repeating what he did in the 60s when I did it in the 80s. But as we go forward, a standard that's been used for governments and others is peer-reviewed literature to make regulations. So there's this idea that, and especially in the US, environmental EPA says we need to have it be a published peer-reviewed assessment to be able to be quantified for whatever. And as we go forward and we disseminate through non-governmental organizations, all these white papers and things, the media on which it's produced will not necessarily be around in 15 to 20 years. You think the internet's a stable thing, it is not, right? I mean, Betamax versus these. So we have this continuity issue where it's important to have something that's showed the test of time, which is peer-reviewed publications, but that can't be the only thing. Because it's very hard to communicate to local communities of paper, right? So we need both mechanisms in there. And I worry that what we use now as our technology won't even be around in 10 years. And if you just imagine, I started my career before cell phones, right? My father started before Watson and Crick double helix. But this is a game changer. But it will not be here in 20 years. I'm pretty sure we'll be doing something else. So how we communicate and make it institutionalized for a standard in there, but also be adaptive will be important. If the wash sector can push that, that would be really cool. That's my pitch. I don't have it.
It's a really interesting point. Something you mentioned at the beginning is I've seen literature saying the one thing that international development sector, not just WASH, but broadly is really good at is recycling the same old things and then putting a new labels on it. And this person said adaptation, climate change, resilience is the new label for things that we've been doing always. And I agree to that to some extent. Don't get me started on climate resilient water safety plans. The new label for something we've been doing since the 70s. But yeah, it's a really interesting thought about how to make use of new communication mediums as they develop and how we use that to evolve our approaches. Any other comments, thoughts? Yes, over here.
Hi, I'm Savannah from Churchill Service. I'm opposite to my colleague. I've been an implementer for 25 years. And I've been to many scientific conferences like this one at different times. And I still, when we're talking about evidence and knowledge, I still see the lack of availability of knowledge. Like I've been to many presentations and I say, can you send me your work? Because we are looking at doing X, Y, Z. And why reinvent the whole thing? Oh, no, actually, you can go to our website. This is not available because it's still research. So there is still that barrier. So I do feel we're reinventing something that we've been doing the same poster presentations that we were doing 20 years ago. So it is a little frustrating to me to come to what evidence and knowledge is needed going forward. We have it, but we have to share it. We have to find a way to share programmatic experiences of what works and what doesn't, without there being a barrier is research. And many of our organizational websites have become marketing tools. So there's less available in terms, 20 years ago, our websites were resources for programmers. We had briefs, we had tools. Those are no longer as readily available as they used to. So there's something in the evidence knowledge, and many of you that work in academia and maybe look into this, because it has become a barrier when I want to share things with my team in the field, and I just can't, literally just can't. So that is something that for this question, maybe it's a question for this another.
Thank you. Yeah.
Yeah.
We've got a few minutes.
But I think what you said is really valuable, and I just want to highlight the sharing the failures. I think is also really extremely important, and I think we're very hesitant to do that because of our branding and our marketing and just how we sell ourselves to the outside world and our clients and our partners. But sharing our failures is, it would have so much potential to really avoid other people making the same mistakes we've done, and just being critical and reflect about what we've learned. Just maybe sharing our failures in a constructive way. But I think that's something that we need to start doing more in the WASH sector, especially because we don't want to keep reinventing the wheel and just have everyone, you know, there's limited resources. We shouldn't all be just doing the same thing and failing at it every time. So yeah, I think it's an important reflection. Thanks for sharing that.
Thanks. Yeah.
I agree completely with that. That is so important.
Thanks. Yeah. Well, maybe have yours as the last comment, and then we'll wrap up.
Oh, pressure. Yeah, I just wanted to build on that, but I wanted to add a little bit that it's more than just our egos that are at play. It's systemic. So, for example, when you get funding, a lot of international development funding doesn't actually like that you do research, and academic funding doesn't like that you do implementation or development. And so there needs to be a little bit of a softening of those barriers, I think, if anybody in here is part of those organizations. But the other problem is with respect to those types of things, is that there's also a lack of courage sometimes in funding and things like that. We tend to sort of repackage similar questions over and over again, and try to maybe a new context or something like that. But
But, trying to sort of take risks in going into something deeper and being willing to fail. Is something that the system, I'm not sure, is quite tolerant of or accepting. Everybody wants to see results.
Evidence-based versus innovation.
Well, and you want evidence of innovation, but it's
1 to 2 years.
That's right. Exactly, yeah. So, there's a lot to unpack there, but I mean, even getting to these questions of what we need to do with respect to getting people to use climate resilient toilets is, I believe that often these are fundamentally socioeconomic and particularly social problems. Or challenges, I guess you could say. It's not even, for some people, it's not a problem for them to do it. And the old investigation things that we're talking about, to some, it's a positive thing. So, being able to look at things like that rather than just sort of measuring what toilet works better here, things like that. It's harder work, but it's something that I think is ultimately potentially more valuable and impactful in the long run.
Great. Thanks so much for that. Really great thoughts, everyone. We'll go end it there. That was really, really cool. I really enjoyed hearing from all of you guys. I really like these sessions where we get to interact and give everyone opportunities to talk. Jamie or Avni, anything else you'd like to add? I think we're all good. Thanks, everyone.
Thanks for sharing.
Spend 10 minutes maybe jotting down that discussion.
Yeah,
Just the key points. A lot of different based on what was said rather than my interpretation and what I remembered.
Yeah.